Hi, so Nursing Professor here. Today we're going to talk about health assessment part 2. All right, so the last time we talked about how to gather information, having a conversation with your patient, not reading from a script, giving them time to actually talk, and they're going to share with you a whole lot of information. So there's a couple of other things that I want you to be aware of as you are doing this interview. You want to use both closed-ended and open-ended questions. By that I mean this. Closed-ended questions are those that are either yes or no. No in between. If they're open-ended questions, then that is where you have you give the person an opportunity to expand upon their answers. So it's questions like, how do you feel today? So that they can have a whole statement and describe to you things about their particular complaint. All right. So we want to establish trust. It's very important. So make sure that you're allotting time for this to actually happen. Don't have people knocking on the door saying, oh, your patient in 212 needs pain medicine. None of that. You try to say, and it depends on you. I usually can do it in 20 minutes. So I say, don't disturb for 20 minutes. I'm going to be in with the new admission. If it takes you 30 minutes, you need to say that, because you will find that you're going to be a whole lot more efficient. You're going to establish trust with your patient, and your patient is going to tell you more, which is what you needed by doing this particular assessment. So there are some barriers to communication that actually happen when we are gathering this information from our patients. So today, I want to identify some of those. All right. Don't lead your patient. Don't say, how do you feel today? You feel fine? No, because many times patients want to please the healthcare provider. Don't ask too many questions. Make sure your question is clear and concise so you don't have to keep asking a whole lot of questions about a particular incident. Giving them time to answer. Many times we're so rushed, and this is why it's important to set aside that time so you're not rushed, and give them the opportunity to answer the question. Don't use medical jargon. Everybody knows you're smart, you're a nurse. You don't need to talk about how's your fibula today, how's your leg today, okay? Don't use the medical jargon. Don't assume what the patient means. If you're not clear, ask, so that you can get clarification. Don't use cliches like, oh, you're going to be okay. Oh, you'll be out in a couple of days. Those kind of things like that are quite misleading, because you don't know. You literally don't know. And never ask the question why. Why is very confrontational. For example, if you ask a person, well, why did it take you so long to come in today? Well, what do you mean? I'm here today with my complaint. So never start a question with why. And that's very important as you do practice test questions. If the answer is ever why something, it is the wrong answer. So you can already eliminate that. Don't give false reassurance. Don't change the subjects inappropriately, especially if you're the one that's uncomfortable with it. Because sometimes we get uncomfortable with what a patient says and we want to move on. So we don't give that emotion. Don't offer your opinion. Don't stereotype. Don't use patronizing language. I hear so often people talk about sweetie, honey, mama, auntie. No, I'm none of that. That is your patient, and you want to maintain professional but friendly relationship with your patient. Then you want to pay attention to people with special needs. So these could be people who have visual impairments, cognitive impairments, hearing impairments, even cognitive disabilities. So you want to pay attention to those and adjust your line of questioning, your way of gathering information from them. For example, if you have a patient who's hearing impaired, then you might need to write things. You might need to use TTY in order to communicate with them. You want to make sure that their television has closed captions on it. But many times in today's world, these phones of ours can actually allow that conversation to happen, and your patient will know how to do it. Don't talk loudly like the person is going to hear, because they're not going to hear. Okay. Visual impairments, make sure a person has their glasses. If there's any way to have large print, make sure they have those large printed documents in order for them to sign, like consents and things like that. Make sure the lighting is appropriate as well. People who have aphasia from a stroke, remember there's two types of aphasias. One is expressive aphasia, and that is when your person is actually taking in information, however, they cannot talk. So they understand what you're saying, but they can't talk. And so you might use things like communication boards, give extra time, allow them to see if they can find the right words or not. Then the other aphasia that we have is that people can't interpret what you're actually saying. So they really do have a cognitive disability. And for those people, then you might want to use more of gestures, pictures, things like that, because they're not going to understand. The brain has been injured. Now, many of those people are able to come back from those deficits from a stroke, but at the early onset, those are the deficits that they have. Make sure if you're gathering information from a person with a learning disability that you're asking very simple questions. Allow them time to answer. Don't rush them. One question at a time. Don't give them 5 different directions and expect for them to be able to answer. And if they have a secondary source, then that's fine. You can gather information from the secondary source, but when you're documenting, make sure that you indicate that. All right, another set of patients that we frequently meet are aggressive or challenging patients. Now, these patients can be, just as I said, very challenging to take care of. You want to remain calm. You want to remain empathetic. You want to be reassuring and get them to build the trust. Don't argue with them. Just try to reassure them. Sometimes you might not be able to get through and you might be the wrong person. Maybe you remind them of somebody. And it's okay if you gather someone else, switch, have someone else come in that person may be able to establish a rapport with. All right, and then sometimes it's a matter of just leaving and coming back and there'll be a different person, but don't get caught up in that energy where you're having a confrontation with a person who is aggressive or challenging. All right, language barriers, translation, either hospital approved translators or using the translator computer or phone, whatever your institution uses. Don't use kids because they can tell you, they can deliver the wrong information. So you want to ensure as much accuracy as possible. Patients with low literacy, many times people will not tell you that they can't read or can't read well. And so again, you're going to use very simple questions. Ask if they understand what it is that you're actually saying. Use pictures, diagrams, demonstrations to help them understand. Because usually you can pick up if somebody's having a literacy problem or not. Cultural considerations. The best I can say is experience is the best teacher when it comes to cultural considerations. Whatever you learn from a patient, carry it on to the next and the next. And always, if you don't understand something, ask your patient. Ask them about their particular culture. Most people are fine with sharing with you why they feel the way they feel or what their cultural beliefs are and things like that. But don't make any assumptions with this. This interview is supposed to be able to gather information as accurately and as quickly as possible. So I hope that helps. I will see you next video where we will continue to go into the health assessment. Bye for now.